Hello, this is Danita from Education, and in this segment, I'm going to teach you about MAR and MAR summary. The MAR is the Medication Administration Record. In your menu, locate the MAR. This is going to be a list of medications that are ordered and have been given or are due to be given. So this is one way that you can look at your medications that are due. You will notice that you have a gray bar up here. We are currently looking at a time frame of July 5th, 2:30 p.m. through July 7th, 2:30 p.m. Okay, so that's a 2-day time frame. You can right-click on that and change that as needed, but for the most part, most people usually don't do that. The MAR is divided up into different categories. So the blue fields are scheduled or unscheduled. So that's like your one-time meds, such as a pneumonia or a flu vaccine, or continuous infusions. Your PRNs are going to be in a gray field, and then your discontinueds will be gray. Okay, PRNs will be green, discontinueds will be gray, and scheduled will be blue. Currently, I'm not looking at any. I don't have, when I look at my profile window, I don't have any discontinued medications. I do have a filter up here towards the top left. If I click that drop down, I could go to all medications. And if I had any future or discontinued meds, they would now be showing in gray, which it doesn't look like I do. So I do want to show you that this is one of those pages that you do have to refresh to keep it current, and you really have to kind of stay on top of that, because if the provider puts it in order, like by the time you get your medications out of the med cabinet or med drawer and get to your patient or elder's room, that could have changed. So you just have to kind of keep that refreshed just to make sure that everything is current. From this screen, I can tell what medications I have due when and when meds have been administered by the timeline at the top of my page. So at 2:30 I have a med due. It looks like at 2:35 through 2:40 we had some activity. We started a bag of fluids here. And the yellow box indicates the current time. And then if you look over, that's my next med due is at 9 o'clock. So that's just kind of one way to look at it. Another place that you can go to see when your medications are due is in the MAR summary. And I'm sure if you've been working the floor, if you've worked here as a student or as an intern, you've probably seen different people use either the MAR or the MAR summary. So it's just kind of a personal preference. Neither one's wrong. So the MAR summary splits it up into each column is a shift, is 8 hours. And it'll actually tell you when things are actually due. So it looks like I have a furosemide that's due at 14:30. And it's not showing my 9 o'clock furosemide. So let me do a little refresh here. I'm not really sure why that's doing that, but it should also be showing my 2100 furosemide here. Oh, maybe because, sorry, I ordered it daily. It's not BID. So that's why that's not showing. You can see that our patient was offered Tylenol at 2:35 and refused, and then we can also see when that bag of IV fluids began. So you just look at that whole column and see when your medications are due. So it's your preference. Some of us prefer MAR, others prefer the MAR summary. I'm going to go back to the MAR because I want to show you a couple other things that you can do from the MAR. Now, the client nurses will be administering medications from the MAR. To administer the med, you're simply going to click on the box. It will pop it open. Your preceptor is going to teach you how to do that specifically. What I want to show you is just some other functionalities here. The first thing I want to show you is if a patient refuses a medication, what to do. So basically, you're going to locate the medication. You're going to click on that box. So I'm going to use my Tylenol here. In the train domain, you're going to get this has not been verified message by pharmacy. Just disregard that. Go ahead and click yes. Since this is our train domain, our pharmacists do not verify those meds. If you get this message in real life, you should not bypass it. You should not continue until medications are verified unless it's an urgent or emergent situation. The nice thing I like about Cerner is that it does give us this acetaminophen dosing tracker. So it will actually watch the total of medication of acetaminophen that my patient or elder is getting, and I can keep better track of it. So once I get closer to that maximum daily dose, it will be showing in this window here, and that's a nice little reminder pop up so I don't accidentally overdose with acetaminophen. So this is my administration window, or this is my dialog box, and I'm showing you how to do a not given. So you scroll down to the bottom of this box, you will find the field that says not given. And I'm just going to put a little check in the box beside not given. My reason is required, so I'm going to click on that drop down, and it's going to give me some nice medication related reasons why I'm not giving this medication. So I'm going to do patient refused. In the top left of the dialog box, I'm going to click the green check mark to sign my documentation, and then I'm going to refresh. It will display in my window not given. When I hover over it, will say why it was not given. You may see some people do a not done, and we don't want you to do the not done because it doesn't give you medication related reasons. The not done happens when the nurse right clicks on the field and selects chart not done. You get a similar pop-up, but your reasons, as you notice, are not medication related. These are some pretty generic reasons. Due to the way Cerner is built, this can't be removed from the medication administration window. So we just discourage you not doing it this way. Always go into the medication and do a not given. Okay, and again, I'll show you that one more time. Just click on it, open up that dialog box. Scroll down to the bottom and select not given. Select your reason and sign. There is a way to do that from within the medication administration wizard, which is how we administer medications on the Great River side, and I will show you that when we go over that in the live session. If you give a medication and you need to unchart it, you can do that from this window also. So I'm going to go ahead and I'm going to do this manual administration of my Lasix here, so my client nurses can kind of watch and get an idea how to do that. So I'd open my window, and I'm just going to verify that all my information is correct here, and then I'm going to click my green check mark and refresh my screen, and I have now administered that medication. So you see here I administered it at 2:52, so my box back here disappeared, but here's my auth verified, and that means it's been administered. And then it's not due again until 9 a.m. tomorrow morning. Typically, if a patient's not going to take a medication, hopefully we know that before we sign our documentation. But sometimes patients or elders will change their minds, or maybe they're confused and you already signed it and then they refuse it. So to unchart a medication, you locate the auth verified where you administered it, right click and do an unchart. Okay, now you can see this was a reason that I had used previously, so it filtered back in there. Okay, and so that's kind of a nice feature. If you're doing that on multiple medications, it will just pull that same reason in. I'm going to go ahead and sign it, and now it's marked in error. The other component that I want to show you, let's go look at that MAR summary again with our medication administrations. So your medication administrations that cannot be not given or uncharting cannot be done at the MAR summary. Basically, you can just see the information. It truly is just the summary. The other thing I didn't show you, and you can do this from MAR and MAR summary, is you can actually get your reference information on those medications. So you just right click on the medication, go to the reference manual, and it will pull up that reference information. Maybe you just want to look at side effects. You can click on that link here and it will take you to the field side effects. You can click top, it'll take you back. I show you this in another segment, but you can also print out a little educational leaflet for your patient or elder right from this window. So that's using your reference manual from your MAR summary or your MAR. You can do it from the MAR as well. Okay, again, right click and it will have that reference manual. The other thing that you can do at your MAR is you can actually do a medication request. So maybe I'm going to give my Lasix. I can't find the medication. You'll notice that I have a med request option here when I right click on the medication. Give that window just a second to open up. And so this is what this looks like. So the reason that I'm requesting this medication from pharmacy, maybe I cannot locate it, maybe I need an extra dose, maybe it was wasted by the patient and they knocked the cup out of my hand and it went on the floor. And now I don't have another one to replace it. Okay, so I'm going to select cannot locate. I do want you to notice that the scanning med not identified, once in a while on the Great Riverside, we'll go to scan a medication and it won't scan. So here's what you're going to do if that happens. You're going to go ahead and select that one. Then you're going to scan the medication and it will actually fill in this number, the number associated with that barcode. And when you click submit, it will actually communicate to pharmacy that particular barcode is not scanning. So that's kind of a neat feature there. Okay, cannot locate, and then I usually type in something like checked other Omnicells, the area not available, and then just hit submit. Okay, and then they'll tube that medication to you if it's a medication that can be tubed. I think that's all I have for you on the MAR and the MAR summary. If you have any questions, be sure to contact me at extension 4029. You can also contact my coworker, Miranda Anderson, at extension 4028, or you can talk to one of the clinical informatic girls by calling extension 4400 and selecting option 5. Thank you.